Hi. I'm Robo Susie and today I'll talk to you about congestive heart failure treatment options. Also don't forget to subscribe for more tips in the future. But back to our topic. Searching for an effective congestive heart failure treatment is something that millions of Americans do regularly. After all, their life may depend on it. Nevertheless, there is no congestive heart failure treatment which can cure the condition, only those that are geared towards management. In this article we will briefly delve into the condition itself and examine a few of the more widely accepted congestive heart failure treatment options. CHF, the basics. Our heart pumps to the tune of about 100,000 beats a day, supplying life-giving blood and oxygen to our bodies. When CHF occurs, the heart is no longer able to meet the body's need for blood and oxygen and strains to keep up with the demand. This condition can occur at any age, can be brought about by the natural process or aging and/or diseases like atherosclerosis, and is the leading cause of death and disability in the United States. Symptoms include fatigue, weakness, shortness of breath after only mild exertion, shortness of breath while sleeping, swelling in the legs and/or feet, unexplained weight fluctuation, and swollen neck veins. Conventional congestive heart failure treatment options. The goal of any CHF treatment is to take some of the pressure off of the heart so it doesn't have to work as hard. Diuretics may be prescribed in this pursuit to rid the body of excess fluid which has built up due to poor circulation. Prescription cholesterol medications may be prescribed to keep any additional plaque from building up and keep blood flowing freely through the arteries. Beta blockers may be prescribed to slow down heartbeat, lessen the heart's workload, and decrease the risk of irregular heartbeat. There are even drugs known as ACE inhibitors which dilate the blood vessels, reducing arterial resistance, thus taking some of the pressure off of an already overworked heart. As you can see, there are no shortage of options for medical professionals to consider, and we didn't even get into the surgical possibilities such as balloon angioplasty. Congestive heart failure treatment options from a natural health perspective. CHF is most often seen in seniors whose heart simply starts to wear out over time. In fact, by age 80 the heart will have lost on average about half of its pumping power. It goes without saying that if there are any other extenuating circumstances, a rough ride to the hospital emergency room could be in store. Nevertheless, until that day comes, there is a great deal that can be done naturally to hold off this deadly condition, starting with lifestyle changes. Common sense changes such as quitting smoking, only drinking in moderation, reducing sodium intake, maintaining a healthy weight, eating a low-fat diet, drinking enough fluids for hydration but not so many as to put pressure on the heart, and daily doctor-approved exercise that is appropriate for your level of general health are all excellent suggestions that should be implemented as soon as possible if you feel CHF is present. Supplements are another area which could prove helpful. Examples would include molecularly purified fish oil, B-complex vitamins, along with a natural cholesterol reduction supplement specially formulated to lower bad cholesterol and raise good cholesterol. In conclusion, finding a congestive heart failure treatment option that is right for you is a complicated issue that should be discussed in depth with your doctor. That said, recognizing CHF early and taking steps to manage this condition through natural means before it gets out of control could literally save you life. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.